Good morning, everyone, and welcome to Great Day Houston's Silver Lining Show. Thanks to modern medicine, we are living longer, but our guests today want you to enjoy quality of life as well. In 1926, the average lifespan was about 57. Today at 79, it will be closer to 100 if not for the #1 killer of both men and women, heart disease. What if you could stop it before it even started, or at least fix it before it became fatal? Well, for the most part, you can. Cardiologist Dr. Dorothy Pei with Modern Heart and Vascular Institute joins us with why women in particular need to be a beat ahead. Good morning.
Good morning.
All right, you are a self-professed foodie.
Yes, I am.
Well, and it's funny because so many times people go, oh, if I got to take care of my heart, that means I can't this, and this. In moderation, right?
In moderation, yes. I mean, I definitely, try to eat healthy every day, but occasionally indulge myself, but again, in moderation.
Yeah. When it comes to heart disease, it's interesting that one person dies every 34 seconds, about 700,000 people to 950,000 people annually. It kills more people than all cancers combined, but cancer is that word that strikes a lot of fear in us.
Yes.
And rightfully so.
Oh, yeah.
But we need to know that the narrowing of the heart arteries and all of that is the #1 killer. Some common myth happens mostly to men.
That's definitely a myth, yes. It's pretty much 50-50s in men and women.
Yeah.
So very commonly, a lot of people think it just happens in men, but that's not true.
All right, another myth. I'm too young to worry about it.
We are actually diagnosing more and more people who are young. So yes, you do want to start worrying about it when you're on the younger side.
Yeah, because it's what you do on that. Yeah, the body is very forgiving. It gives you some time, right? It's what you do on that front end that can really impact what happens on the back end.
Correct. Yeah. I mean, definitely, on the younger side, if your lifestyle isn't the most healthy, you definitely want to start worrying about heart disease.
All right. The other thing is, I'd have warning signs, right, leading up to it. I'd catch a heart attack, right?
Not necessarily. Actually, a lot of my patients, not a lot, but a good amount, especially women, don't tend to have symptoms. So you definitely, it can be a silent killer.
Yeah. The other one is, for example, diabetes, #1 reason for heart disease. And people go, well, I'm taking medication for diabetes, so I don't have to worry about it.
Diabetes medication can be effective for diabetes, but it doesn't fully protect your heart. So you definitely want to be on different medications for heart disease.
All right. And still have to modify what's causing that heart disease,
oh, yeah,
right?
For sure.
Okay. Some of the risk factors and why people should get checked. One of the things, and we're going to go through this list of risk factors and why somebody might want to go in and get their heart checked if they have not had it checked. Nearly half of American adults have risk factors for cardiovascular disease. So lifestyle is 80% of the issue, right? Let's start with, I said diabetes before. What does diabetes do to the heart?
Diabetes obviously raises your sugar levels, and that sugar can really affect the arteries and cause all kinds of things. It can increase your risk for high cholesterol, and again, cholesterol is the thing that clogs the arteries.
Yeah.
So.
All right, so high cholesterol, high blood pressure. If you have that alone, it's a good reason to check on your heart.
Yes.
Smoking and obesity.
Smoking and obesity, correct. Yep, those are definitely things that can increase, your risk for heart disease and cause, again, that cholesterol and clogging of the heart arteries.
Sedentary lifestyle, and of course, excessive alcohol. All right, heart disease symptoms. Women can present a little bit differently. In their earlier days, all the research was done on men. And so then they were surprised to find out, well, a lot of times what's happening in men is not happening in women, or sometimes it's more subtle, often more subtle symptoms that are easy to dismiss in women. For example, nausea, unusual fatigue. Okay, that can be a norm, right?
Yeah. You can also get things like just palpitations, nausea, you mentioned lightheadedness, and again, some women just don't have symptoms.
Yeah, at all. Yeah, a little pain in the back, the jaw, the neck, shortness of breath. But all those things that we just mentioned can be attributed to just all kinds of other things that are not quite as severe.
A lot of people think it's like anxiety or menopause or just part of aging, so it's easily kind of overlooked.
Yeah. Another big myth is that heart disease runs in my family. I can't do anything about it anyway. Or it doesn't run in my family, so I'm not worried about it.
That is a huge myth. You can do a lot of things about it. I mean, you can definitely, change your lifestyle, make it more healthy, and then you can also get checked up. see a cardiologist, and just kind of run some tests just to make sure that everything looks okay.
Yeah, yeah. And if things don't look okay, there's a wide range of what you can do. And that's one of the things that a lot of people are afraid to find out what's happening. But trust me, you want to find out what's happening now before something big happens. But interventions can vary from something that's simple to full-on surgery.
Yep. And also, these days we have so many non-invasive things that we can do, including imaging. The procedures that we have, all you do is kind of access a vein or an artery, and then you go home with nothing, like pretty much just a Band-Aid.
Yeah, yeah. All right, let's talk about some of the symptoms in men. We talked a little bit about with women, but in men in particular, and again, they can also not have any symptoms, except the first time they have a symptom can be the heart attack itself.
Yes.
But what things should they pay attention to?
So men typically have more typical symptoms, so chest pain. They can also have shortness of breath, and the chest pain usually happens when you're trying to exert yourself, so exercise, but it can also happen at rest as well.
Yeah, and it's so important to look at where you go, because it does matter. You and I were talking in the green room earlier. My mom had conjunctive heart failure, and they said to her, she was in San Antonio, and they said, there's just nothing we can do about it. She has 6 months to live. And so I moved her here to Houston, and then a doctor goes, well, we can just do the TAVR procedure. I'm like, well, what is that? Why did I not know about that? And you know, she went on to live several more years in comfort. So we say Modern Heart and Vascular. Tell us about how you're set up. You're not the hospital. You're a group of doctors whose expertise is in all areas of several different things, but in terms of cardiology, in several parts of cardiology, it's not just one thing.
Yeah, so I'm a general cardiologist, so I kind of am the first stop where you see a general cardiologist. I kind of look over everything, and then I kind of refer you to our specialists. So we have interventionalists who do procedures, like the TAVR you mentioned. We put stents in as well, and then we have our electrophysiologists who put in more of our deal with the electricity of the heart. So they put in pacemakers, they do something called an ablation to get rid of arrhythmias. So that sort of thing.
Yeah, and it can be just downright somebody saying, look, we see little things coming around the corner, we're going to do a lifestyle change, even what foods you should be eating and all that, right?
Yep, I mean, that's kind of my job. You know, if I assess there is no heart disease, but we want to prevent it, then I do talk about, you know, things that you can do just to go ahead and, again, prevent that heart disease from happening.
I had the imaging of my heart, and that could show you exactly what's going on there. And he said, okay, nothing going on with your heart, you're good, go on your merry way, right?
Yes.
But what does that imaging process look like? So at first, if you have that, especially when you have some of those risk factors, if you have that baseline, you can actually see where you're at and where you're going.
Oh yeah, I mean, I usually start with some imaging. So there's something called an ultrasound of the heart that will check your heart muscle to make sure it's nice and strong. We do have other things like stress tests, which check the heart flow in your heart to make sure that the arteries are okay. And then we also have even more advanced imaging called CT, where we can actually look at the individual arteries to see how much calcium is in it.
Yeah, well, Dr. Pei, thank you very much.
You're welcome.
The bottom line is just know where you stand.
Yes.
Because again, I still find it interesting that a lot of what happens to us in terms of fatal heart attacks is preventable. As we mentioned, dying from heart disease is oftentimes preventable, especially if you have any of the risk factors that we spoke about. Get checked. Don't depend on symptoms to let you know something is wrong. You can schedule a cardiology visit with Dr. Dorothy Pei at Modern Heart and Vascular by calling this number. It's 832-644-8930. Again, that number is 832-644-8930, or visit them online at modernheartandvascular.com. They have 8 locations throughout the greater Houston area.